I saw in the mirror that one side looked bigger, and I pulled back my lip, and I saw that there was actually something there, but I thought that that might be supposed to be there. I didn't think that there was anything wrong.
And I asked her if it hurts, and she said, no, it doesn't hurt. The next day, she has an appointment with the orthodontist. He right away took an x-ray and said she needs to go to a maxillofacial surgeon because this is not looking good. We got to the maxillofacial surgeon and they did a CT scan, and the doctor said, this is a tumor. We don't know if it's benign or not, but we need to remove it. We did the biopsy. They found out that it was benign, but they needed to remove it right away because the tumor is one of the most aggressive in its kind.
Veronica was sent to us by an outside surgeon who initially saw Veronica and biopsied her tumor. She presented with a tumor of the mandible known as a myxoma, which is a benign tumor, but a very aggressive one. We discussed her potential plan for care.
The doctors were really great. They explained every process.
The treatment that we discussed with her was to remove the tumor in whole with that segment of the mandible and then reconstruct that by harvesting some bone graft from her lower leg.
In Veronica's case, her benign jaw tumor involved intimately the inferior nerve, and therefore that nerve had to be resected along with the tumor itself. The inferior nerve supplies sensation to the lower lip and chin primarily. If you're left with loss of that sensation, that's a significant impact on quality of life. Patients are left with a numb lower lip and chin. In social situations, food gets caught in their lower lip and chin and they're not aware of it. They're not able to kiss their spouse or significant other normally. The inability to chew and speak properly, and if you have to live with that for the rest of your life, that can be devastating. We are grafting the nerve at the time of the reconstruction of bone and soft tissue, and it's critical to have a team approach where the surgeons work collaboratively.
We perform what's called virtual surgical planning, where essentially we perform the surgery virtually before you even go into the operating room. Several weeks later, we executed the same procedure that we planned that day. We accessed the tumor, we removed it, we went down to her lower leg where we harvested a bone graft to place that into the area that we removed, and then we performed the nerve graft portion of her surgery.
The specific nerve technique that we use is a connector-assisted repair. We measure the distance that we need for the axogen advanced nerve graft, and we use an Axoguard nerve connector at each end to allow the nerve to connect to the nerve graft, both proximally and distally.
After the surgery, for a while, I didn't feel anything from here to here. I was nervous about if the feeling would come back.
If Veronica didn't have any cessation whatsoever, her life would be totally different. She will be drooling, and maybe she will have problems with the speech too.
The first moment that I realized that I was getting my feeling back, I was brushing my teeth. The foam gets everywhere. It was like a tingling sensation. I haven't felt it for a few months, and suddenly I was feeling something, so I really felt hopeful, like I'm gonna get my feeling back.
In Veronica's case, we saw results in a very short period of time. That nerve graft is typically, in these ablative cases, approximately 7 centimeters long, and that takes a long time for the nerve to recover and grow through that nerve graft. Despite that fact, in almost my 10 years of using the Axogen Advance allograft, we have seen recovery of sensation within several months after surgery.
So she's going back to normal slowly to all her activities, especially Taekwondo.
Once the nerve was getting better, I could talk better. Eating was definitely a lot easier. I could control, to make sure that food wouldn't fall out. So it was really nice once those problems all went away and I was back to normal.
Helping patients is number one. Seeing a patient like Veronica with this aggressive jaw tumor be able to be treated is extremely rewarding. We are so happy to treat patients like that and bring them to functional rehabilitation.